I have a Norwegian elk hound. He's a big part of my life. You know, they have to be when you have a dog. So it's difficult to train him, but I went to an extensive 10-week course, and he did great. So I'm not saying he does now because I haven't been able to work him the way I would like.
So how are you feeling today?
I find out that I get angina very easily now when I'm walking and short of breath. I had my first heart attack in 1977. I was just barely 43 years old, and I had an open heart surgery then, again in 1989. At that point in time, they were just bypass surgeries. The same arteries were clogged, and now it's a valve that needs replacing. That's why I've gotten to this point. I've had the 2 open heart surgeries, so I'm not a candidate for a third.
At this stage, open heart surgery is still the gold standard. But there are many people, like Elaine Conway, who is not a candidate to undergo a sternotomy. She's already had 2 previous surgeries. So she had a narrowed valve, and without this procedure, she would have to live with this narrowed valve and could not undergo surgery. What we mean by transcatheter is, instead of cutting through someone's sternum, we can place a small tube in their leg, in their femoral artery, run that up through their aorta, put in a new valve without having to do formal surgery. In terms of innovation, this is the biggest thing that's happened in interventional cardiology in 15 years.
And once we bring the valve up, it's mounted onto a balloon, so we inflate the balloon, we expand the valve right in the aortic valve, deflate the balloon, and then the valve stays.
We treat the people now who couldn't otherwise have valve surgery, whether it's sickness, age, frailty. But if you previously couldn't have a surgical valve replacement, we can now do that in the vast majority of cases. Let me just listen to your lungs here. Deep breaths. Okay, so it's been 1 week since your procedure. And as far as I'm concerned, you have no limitations, all right? I want you to get out and walk. I want you to resume all of your previous activities.
Good boy.
So we're kind of moving from an older, more established technique to a new technique that allows for rapid ambulation and rapid discharge from the hospital. So I believe that this could be the wave of the future.
Sit. Well, it's more than I ever expected. It's happened, it's here now, and now I can get back with doing what I ever want to do. I can do more traveling if I want. I can get back to my normal regimen of exercising. I just had sort of put everything on hold, and now I don't have to do that. If I didn't have it, I would have probably 3 years to live. And with this, I have a lot more years to go.